said, I was an aide myself. I worked in home care and I worked in a nursing home for many, 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 many years while I was going through nursing school. Today is a great day at Reliance. It is something that I have worked on for so long, and we are just so proud to be offering a clinical rotation through a home care agency for nursing students, because right now home care needs nursing students to know what home care is about. And we're going to go over how many hospitalizations did we have, how many incidents did we have, how many complaints did we have, how many falls did we have. You know, COVID brought out a lot of different issues, and I think it really did shine the light specifically on home health care and how essential these workers really are. So for me, it's always about bringing the youth into home care, showing them exactly what we do in home care, and it's not a scary job. It's not scary, to say that they're a home care worker, but on the positive side, they can be proud of it.
Is it reimbursable by insurance, or patients are paying? I have a lot of experience myself in home care and hospice home care. You are on the road, you're independent. It is a very challenging field, and I particularly think it's wonderful.
I used to be a nurse liaison for VNS Home Care, so I have many jobs, by the way. Labor and delivery, open heart, case management, but home care is my niche. I found my niche in home care. But speaking as a nurse liaison for VNS, we would go in and assess the patient to see if their home care, if they're able to get care at home, because not every patient is a home care patient.
We're part of the community mental health class, so we were advised that this opportunity would be available to us. This will help students when they're in the hospital to realize that they should be aware of where patients are being discharged to, that patients are not always going home to a safe environment. They might not have all the resources that they need in the home, and that they really need to be a patient advocate in the hospital also, and listen for cues that the patient does want to go home and says, oh, well, everything's taken care of. But then if you hear, oh, well, my daughter works and I live alone and I don't have a car, maybe you should start investigating and working with the discharge planner at the hospital.
My daughter's a nurse. She went through all her clinicals, and I'm like, Jessica, why don't they give a clinical in home care? Because home care is the future of healthcare. The home care worker knows the most about the patient's welfare, because they spend 7, 8, 9 hours a day. They speak their language. The clients trust the workers. My name is Rona Shapiro. I'm Executive Vice President of 1199 SEIU, in charge of the Home Care Division. I'm very thankful to Farmingdale, and I'm very thankful for Dana and her staff that she was actually able to bring to fruition an idea that we've been thinking about for years, and that is the value of having nurses do a clinical rotation in home care. People have a right to age in their homes with dignity and respect. So we're very excited because we know, seeing all these young, enthusiastic nurses that want to learn and want to care. And I think being in the home care experience can only make them better nurses and better healthcare professionals.
I know you want to be specific talking about tuition reimbursement. Right. We also call tuition assistance program because the tuition could be either reimbursed to you or issue a voucher directly to the school. We are here to support our members to achieve their career goals and education goals. And I like this idea. They get to know what the home care workers work look like, their day look like. So they have a better option to see the whole healthcare team. They have all the dot. It's not just go directly to the hospital.
There's an art and science to nursing, and I would suggest you practice both. The science is that I know what COPD is, I know what to do, but the art is when you give of yourself and you go that extra mile.
I chose nursing because my sister was sick for a while. She had leukemia, and the nurses impacted my life, her life, my whole family's life in a very significant way. and I want to be able to impact other families like they did for us. Anyone could walk into a patient and say, "Hi, my name is whatever. I'm going to take your blood pressure. Are you okay?" And then walk out of the room. But another element comes when you then get to know the person, you get to know what they like and their interests and their concerns.
If you talk to older people and you say, "How do you feel?" "I'm fine." "What's wrong?" "Nothing." Meanwhile, they got UTI and they got this and they got that. And so it's very easy for the doctor to miss a lot of these diagnoses, because unless you're actually in the house, know how many times the patient is going to the bathroom or not going to the bathroom, knowing if the patient's sleeping or not sleeping, all of those kind of daily living actions tell about the health of the person. And so when a nurse comes into the house and they say, "So how is your patient doing?" We are trying to train new nurses, and they see a home care worker in the home, to talk to them.
I think the thing that stood out the most was that the aides are a very big part in nursing, and they are right next to the nurse. They're with the person the entire day, and like my grandparents have home care, and if it wasn't for the aides, I don't know where they would be.
So we really have to engage these workers and teach them what it means to keep these people at home.
I always just have like a drive to help people. I always wanted to be in the medical field as well. I knew that I wanted patient interaction. I used to be a medical laboratory science major, but I realized there's no human interaction there. You're not really helping people get better. You're just testing specimens.
I will tell you, your skill set is far better being a home care nurse than it ever will be in a hospital, mostly because in the home, you're by yourself. It's me and that patient. It's not.
I think what's most surprising is that usually we're geared to go into med surg, we're geared to go into the hospital, but there's so many different opportunities with home care that we haven't really thought about before. We always think that we're going to lose our nursing skills if we do something other than going inside the hospital, but she was telling us how since we're the only person there, it actually sharpens our skills because we only have ourselves to rely on.
I've worked in a hospital for a couple of years, and so I've worked in all different kind of units. Home care is one of those things I always considered because it's very flexible in terms of scheduling, and I think I like to work by myself. So.
Congratulations on your journey. Good luck.
I was in and out of hospitals from a young age, so I was around nurses a lot. And I also more recently was exposed to being a patient during COVID, which definitely reinforced why I wanted to still pursue this field. And my grandmother was a nursing assistant, and she definitely inspired me, so that's a big reason.
As a nurse, when we're going into the home, if you're seeing anything that looks like it's a little off or there's some complications coming, what our role is to inform the family, inform the doctor, and educate the aide.
Well, I'm a nursing assistant at a hospital now on Long Island, and it is true the aides are the eyes and ears of the nurse. We are there, we see things sometimes when the nurse has a lot of patients. I work in an emergency room, so it gets very hectic, and we are the ones who can catch things sometimes and bring it to the nurse's attention to really get the patient the help that they need. We all work as a team, but the home health care aspect is definitely underreported. We don't know enough about it, so to do at the clinical level, it's definitely opened my eyes to maybe pursuing, as Melanie had said, later in life, to do this as maybe a part-time profession.
We're going to do some starter cares here today too. We're going to show you the paperwork. I'm hoping that this is the first of many. We're looking to engage as many colleges and nursing schools that we can in order to help promote and educate them on home health care. If there is a nursing college out there that is interested in partnering with Reliance or learning more about our clinical rotation, come down to Massapequa. We are here. I am here. And we can start that conversation. We'd love to talk to you.